Healthcare topics you need and wellness tips you deserve, all straight from the doctors themselves. Maayong Adlaw, Cebu. I'm Kriya Padilla-Roleda from CDN Digital, together with the hospital at Maayo, and this is Maayong Adlaw Doc. In the last episode of Maayong Adlaw Doc Season 3, our guest Dr. Brian Lim gave us updates on COVID-19. Today we're going to talk about another type of infectious disease. But before we head over to our talk and introduce you our guest for today, let's watch this video first about the hospital at Maayo General Consultation Suites. The General Consultation Suites comprise of various internal medicine and pediatric specialties in the fields of infectious diseases, psychiatry, and pulmonology, among others. These services provide patients with personalized treatment plans and collaborative care from a team of competent and hospitable physicians. It is an integral part of the hospital at Maayo's multi-specialty practice, which is a one-stop shop for all their clients' healthcare needs. Here in one of Cebu's bustling cities, Mandaue, the hospital at Maayo is designed to give you the care and services that you deserve. They prioritize you and your health, put your needs on top, and they make sure to give you a holistic medical experience. For today's episode, we will be talking about an infectious disease that we actually grew up being scared of. And that is the chickenpox. So let's learn more about this infectious disease from our guest doctor today. A pediatrics infectious diseases specialist who is proficient in vaccinology, animal bites, and hospital-acquired infections. He holds active physician positions and chairs and committees in various hospitals in Cebu, such as the hospital at Maayo and the Changhua Hospital. He is the immediate past president of the Philippine Society of Microbiology Infectious Disease, Cebu chapter. From the Cebu Institute of Medicine and completed his residency training at Changhua Hospital. He then pursued his fellowship, subspecialty training from the University of the Philippines, Philippine General Hospital. Let us all welcome our guest for today, Dr. Jonathan Lim. Hello, Doc. How are you?
Hi, Kri. Good morning and good morning kanyang tanan.
Yeah, so we're going to talk about chickenpox today. Have you had chickenpox?
Well, unfortunately, yes. Or should I say, fortunately, yes. But elementary pa ko ato.
Mura magnangutana lang if you have you had breakfast, no?
Yeah, well, if you're gonna ask me that, my answer would have been no if pakanon ko nimo.
pero kung hindi ko mangutana, nakakauna ka.
Yes.
Anyway, proceeding to our topic, Doc. I asked, have you had chickenpox? Because this chickenpox is like, it's affecting everybody. Almost everybody has to go through that. Why is that? What is chickenpox exactly?
Well, chickenpox is, well, we're familiar with COVID, right? With the pandemic nowadays. Well, chickenpox is also a virus, but it's not related to your COVID,
Okay.
no? So, being a virus, the problem here is dali siya makatakod. In fact, mas makatakod siya compared to your COVID, for example.
Really?
Yes, it's more infectious. They estimate na 90% of the people sa balay nga wa pa ng chickenpox matakdan if someone will have chickenpox.
What's chickenpox gani in Bisaya?
Chickenpox is hangga.
Hangga.
Sa Tagalog, that's bulutong.
Oh, in my head kay hagna. Place man di ay na involved. Okay, so it's hangga, okay?
Hangga.
Now, nganong everybody man in the house will have to be affected?
Well, infectious siya in such a way dali siya makatakod. No? So, the thing is, it's not just atong tinuuhan manggod kay katong tubig niya or ang nana. No, that's how it infects. Sample, ang mama nagbantay sa bata. No, and then syempre butom na krugayan, and then so the mother gets infected. But it's not just that, it's also the secretions, laway, musinggit ang bata, muhilak, and ang bantay dili immune, and then also airborne, so muatsing, muubo. So it's just like similar to your COVID pod na makatakod yun siya with the secretions.
So speaking of COVID, you mentioned chickenpox, COVID. Is it more difficult to have chickenpox nowadays, considering we're going through pandemic?
Well, difficult, I would say not really, because with chickenpox, mao naman ko yung symptoms, no? But there are several complications. Unlike COVID, you're sure that you only get cough, colds, and fever. But with COVID, you'll never know kung maglisod ba kag ginhawa or dili, which you don't really get in chickenpox unless na high complications with chickenpox such as pneumonia, no? So then you can have difficulty in breathing.
By the way, Doc, other than the bulutong, what are the other common symptoms of your chickenpox?
Okay. With chickenpox, you can have fever, panakit sa lawas, no? Body pains, pangapoy sa lawas or weakness, and katong mga rashes. Yeah.
Alright. Those scars ba, some okay lang, but some mulaong yun siya.
Yes. That happens especially kung imong buton or imong kauton, kay there itchy manggod. No?
So how do we avoid kanang scarring you, Doc?
Usually for kids, we give something for itchiness, no? Medications for itchiness so that dili nila kauton. Kay mo na mabuton mo pag-kaut, then that's where it becomes mulawom na siya.
Okay. So it would start as if lang, you're like having fever lang yun,
yes,
lang ka, and then eventually you would notice na no?
So in the first few days, we have fever, pangapoy sa lawas, it would be difficult for us to say, ay, chickenpox ni, right there and then, no? Unless you see the, what we call lesions, or katong mga nanubo nga rashes, then that's when we can say nga, okay, chickenpox.
What exactly causes chickenpox,
Well,
Doc?
it's a virus, no? Tao ra pod ang maig-ana. No?
Where did it come from exactly?
We don't know where it came from.
Okay.
No one knows, but it has been with us for so long.
Do other animals get something like this?
Wala. It's not like your monkeypox, for example.
Okay. Oh, speaking of which, what's the difference between your chickenpox, smallpox, monkeypox, and the other poxes?
The other poxes. Okay. Well, with monkeypox, it's different, no? Because usually it comes from an animal, no? Although it came from monkeys, but like in the recent outbreak that we are seeing, they are saying it came from animals, no? And maybe some people had contact with certain animals, then napasa nila to other people. But with chickenpox, tao ra na siya.
Okay.
So it's, you come in contact with someone na chickenpox. Yeah, the problem with your chickenpox, manggod, it doesn't mean nga maghuwat yung kag mangguwa ang rashes. Like most other viral infections, within the first few days before ka nga na ay gibamati sa imong laway, pwede na ka makatakod.
Oh, goodness. How about smallpox? What's the difference between smallpox and chickenpox?
Smallpox is also different, although I don't think we're seeing that lately, no? It has been eradicated na.
Really?
Yeah.
Okay, but what are the symptoms? Just
Similar,
curious,
yeah. Similar gapon na ay manurok.
Is it deadly ang smallpox?
It used to be deadly, no? But I have not seen a smallpox.
For how long?
I've never seen one.
Oh, really?
Yeah. I don't think anyone in our generation has seen one. Yeah.
When was it prevalent, Doc, ng smallpox?
Well, you're talking of, around war or before war,
okay. So, dugay
World War, dugay na. So, wala na yung
eradicated na yun.
Yes,
so, there was vaccine for that.
Yes, there's vaccine for that.
And same thing with the chickenpox, no? For those who don't know, there's actually a vaccine for chickenpox, right?
Yeah, there's a vaccine for chickenpox, but ihatag na to na pag 1 year old and above.
And how long is that going to be effective, Doc?
Okay, so maybe you can go through the schedule no? So when you talk of chickenpox vaccine, we're talking about actually of 2 doses. So for children 12 years and below, so 1 year to 12 years old, they need 2 doses of the chickenpox vaccine, and that's minimum 3 months apart. For example, you give one at 15 months, you can give the next one as soon as 18 months. Although usually we give the second dose once they reach 4 years old. But for 13 years and above, it's only 1 month apart ang imong duha ka doses. But supposedly, lifelong ang kanang
that's good.
Yeah. So with the 2 doses that you get as a child, you're supposed to be protected for life.
Oh, wow.
Yeah.
That's
But then
good.
vaccines are not 100% effective.
Yes.
So pwede gyapon ka malutsan.
So it's not all the time na when you get vaccine, you will never get chickenpox anymore. You're just more protected.
Yes.
No, okay. Sige. Now, we go back to the Doc. We go back to the chickenpox being contagious, no? You mentioned na prior to the bulutong coming out, you're already contagious with your laway and secretion. So, after that, after siya manggawas, like how long is a person contagious during the duration of the chickenpox?
So with the nagawa na to sila, so usually they are contagious until muuga na sila. Mahimo sila kugan or kanang scabs, no, maitom bitaw na sila. So that's when you'd say 24 hours after the last one that comes out, no, niya mo itom na sila, then that's when you can say dili na siya makatakod. Although we're talking of healthy individuals, kay for immunocompromised, like those on chemotherapy, mga cancer patients, those on steroids, when they have the bulutong, no, or the chickenpox, you may have to extend that longer.
I remember when we were kids pa, when you have bulutong, you're not allowed to go to school even if naapa siya because you're still contagious.
Yes. Until mo itom na sila nga
kinanglan mo
mopogan.
itom yun siya. Okay. Kay if naapa siya gamay, naapa na gamay nga wet nga part and it can
and you know how kids are, they would play.
All right.
So, makatakod yun siya.
Okay. Another thing, Doc. When is the season for chickenpox? You mentioned na kids have to be immunized, okay, or vaccinated against chickenpox from 1 year old, no? Who are greatly affected yun di ay ba of chickenpox?
First, with the season, I'm sure everyone is tech savvy karon, and if you check the internet, US data would show nga sa mga bugnaw-bugnaw nga lugar, it's winter and spring nga daghan, but wa man tay winter dere. So it happens anytime of the year. Although pre-pandemic, we usually see them summertime. So the thing there is, mo rin tayo magduwa mga bata adtog beach, adtog park, adtog mall, and play with other kids. Yes.
And another thing po, nganong if somebody has been affected or infected na humana siya sa iyang lifetime of chickenpox, why do they say na okay na ka, you won't get now? Why is it like that? Is there truth to that?
Yes, there's truth to that. That's because once you get the you get infected with the chickenpox, it doesn't really go away from your body. No, it stays in your nerves. That's why you have the likos-likos. No, I don't know if you've heard of that. No, well, it's zoster actually. It's a complication of chickenpox. No, well, complication with open-close parenthesis. No, it happens kung, for example, like ako, I had chickenpox when I was in elementary, in grade school. So if I do come in contact with someone na chickenpox, and let's say my immune system became weak, kaya let's say walay tulog or something, then I can have it reactivated. Murag ma-turn on na pud siya. But it's a different, symptoms are similar.
Pero lahi na siya, it comes in a different...
Yeah, usually one part of the body lang, like sa naong lang, or one side of the arm, yung naana lang siya.
We're talking about the likos-likos, right?
Yes, the likos-likos.
Now, speaking of parts of the body, the bulutong tubig or the chickenpox, is there an area of our body that is usually diha gyud makitaan nga mutubo siya or wala ra necessary?
Well, usually sugod na siya sa upper body. No, mine was on the scalp. No, the first one I remember I was still in school. So ni sakit dire, oy mo na ito. But I think it's grade 3 or grade 4. So it usually happens on the chest, on the back, no. But then it goes down anywhere. So it affects anywhere on our kuan.
And how come na each person also have different food reactions to this? Others will have a lot, like all over. Others almost wala. Like ako, I remember when I was in high school, yes, I started with the one on my scalp, siguro mga duha, tulo, and then one here, and then another one here, and that was it.
Probably because you were vaccinated, maybe.
I don't want to say anything about my mom, but I don't think so.
Okay. Well, it really depends on the immune system, no? But usually what we are seeing among my patients, for example, kung bakunado ka, you can still get the infection, no? So I've said it's 100%. In fact, studies have shown if you only got one shot, more or less mga 87%, 88% protected ka from any infection, but 98% protected from severe disease. But if you had 2 shots, you are around 92-93% protected from any form of infection sa chickenpox. So it's either your immune system was strong,
probably,
or you were vaccinated, probably. We can see that mas gamay. And sa cousin, for example, young kids, I remember this pre-pandemic, the 11-month-old came out with chickenpox, full-blown gyud. The older brother is around 7, was around 7 at that time. I already gave him 2 shots of the vaccine. And within a week siguro, nag-chickenpox pud siya, but gamay ra. Gamay ra. So na-modify ang iyang symptoms because of the vaccine, which is good as compared to the younger sibling nga wa pay bakuna.
Ibas mangluod ako, mama, love you, ma. Now, treatment. Okay, is there any treatment? Because I remember nga during my time, it was the time manggod na I had to perform in school. okay, and I could not afford to have daghan kaayo na outbreak bitaw sa bulutong tubig. They gave me, we went to this doctor, but I was young pa, so I don't remember na, but they gave me this treatment. And I don't know if it was actually the one who helped nga dili siya manggawas.
Yeah.
Is there a treatment for this, Doc? How do we deal with this?
Well, for usual cases of chickenpox, no, or hangga, what we do is we don't really treat them. For normal people, for healthy children, or even adults, we don't really give medications or what you call antiviral or tambal para sa hangga. What we give is like for fever, for itchiness, kana lang yun siya. However, if they see you or they see us, no, they come to see us within the first 24 hours, sigigan sa pagsugod sa ilahang hangga, and then let's say they are immunocompromised, like we have cancer patients or very young, like babies, or little children, we can give oral medications. No?
Mine was oral.
Yeah, oral
what does
medications.
It do? What that oral
It's an antiviral, so it helps mahunong niya ang pag-produce pa yun sa kuan. So mas dali siyang mawala. But
so
usually it works kung ihatag nimo within the first 24 hours. So if let's say last week pa Sunday nagsugod, middle of the week na karon, murag a bit unlikely nga it will have any help.
All right. Because I remember ang ako was ni katul siya. One day lang to, and then within the day also in the afternoon na ni tubo nga ni, and then my mom said, hala ka, mauna na siya. And then I think within the week I had a performance, so gidala din ko sa doctor. So I think that's why it also worked on my
basta
case.
dali yung tambal.
So other than that, Doc, like kana oral, is there any other way to treat this?
We don't really have any other way, no, although there are creams available, but I don't use it, no. So it's, as I've said, usually di mo ginagawa tambalon, no.
Kay virus, we just let it go through its course na.
Yes. Unless mo tong special groups, no, like atong mga gagmay kaayo or mga weak og immune system, then we really have to give the medication. Kani siya, Doc, kaning you mentioned creams, para unsa na siya, kanang mga creams na? Creams is more of kung localized lang siya, but then in infectious diseases, we usually don't use the creams na. So it's only for localized, like bagupa, but usually we give the oral if needed.
How do these creams help?
Well, this would still be the same, no? The same ang cream niya.
Siya.
Yes, it's also antivirus.
Para dili na ang mga secretions there or whatever mukalat-kalat somewhere.
Well, as long as the secretions are there, magud mukalat gyapon siya. Yes, it's more of the pag-replicate or what you call nga pagpanganak sa virus, no? So it would help. But usually again, I very, very seldom, and I can't even remember if I've ever prescribed a cream, actually.
I see. So might as well know na lang.
Usually
again,
no good na.
We just let it
let it go, run its own course.
Now, speaking of vaccine ganina, are there any side effects of the vaccine?
Okay, these are, well, like most other vaccines, no, you can have panakit sa bukton pag-inject. You may have fever, pamuwa, but those are the usual common side effects that we see.
Can I still get
the vaccine?
The
Chickenpox.
So
Okay.
sorry.
Supposedly, well, since you already had it, you're not supposed to get it.
Pero gamay man kaayo, Doc. That's what they say. What they told me was, hala, gamay ra kayo ito imuha, balikan ka ana.
Dili man supposedly. Pero muna, basig balikan taas katong likos-likos. So that's the murag kuan na siya, complication of your kuan. But it's a long term, so we'll never know. And it doesn't mean kinahanglan gyud ta makuha og kanang likos-likos, no.
So do I need, just to be sure ba, like ako, like for example lang, although I'm not really scared, pero if you're somebody who's really scared to get bitaw chickenpox, and then you don't know whether you were vaccinated when you were still young, and then your age is like mine na, pwede pa ba ko?
20?
Wow, that was like 25 years ago. Sige, Doc, pwede pa ko?
Yeah, actually, it's like this, no? With all vaccines, actually, almost all vaccines, if you are not sure if you had the vaccine before, no, like in your case, no, you don't know if you had the vaccine, you don't know if you had the infection, for example, and you want to be protected, pwede rin yung kabakunahan og balik. No, there is no overdose in vaccine. As long as you respect the timeline. For example, nabakunahan ka 2 weeks ago og chickenpox, di gyud ka magpabakuna og chickenpox karon. no? So for adult naman, so you wait minimum of 28 days before you get your second dose. But as I've said, if you are not sure if you had it, you had no more record, and even if you're not sure if chickenpox ba tong imong scar diri or not, go ahead and have your shot. Pwede ra gyud.
Alright. COVID and chickenpox, naabay effect ang COVID with the chickenpox lately in the past 2 years?
We have not seen, or ako I have not seen or noted any dungan na infection, but it can happen, and God forbid that happens to someone. Kaya we're talking of 2 viruses, manggod.
So what
Well,
would be
you
the
would
scenario
expect
if
mas
that's
grabe
the case?
yun. Kaya you have more about duha ka kaaway ni sud sa imong lawas at the same time.
So it's going to be more dangerous, you
Yes,
mean?
yes.
Okay. But so far, wala pa, Doc.
Not that I know of. Well, I've known of patients nga nag-flu o COVID, na bacterial infection with COVID na.
You mentioned nga in the Philippines, usually summertime,
Yes.
no? And it's summertime pa right now
Yes,
here.
correct.
Oo. So far, wala pa.
Yeah.
Okay, so how do we prevent this in the first place?
Number 1 would be vaccination, yun.
Oh,
No, you don't wait for someone in the household, uy, si igsuon na ko, nag-chickenpox, ay harap ako magpabakuna. So ideally, you vaccinate 1-year-old and above, and anyone can have it. As I've said, even if you're not sure if you've had your shots, go and see your doctor and be vaccinated. Okay, it would offer the best protection.
Okay, that's one.
And the problem there, if I may add, is dili ramang good ato ang kawali yung protektahan. If there's someone who's elderly, like bedridden, si lolo, si lola, or your wife is pregnant, kuyaw sad na siya sa pregnant nga babae.
How does it affect the pregnant women? That's a very nice.
With pregnancy, mangkod, it can be more severe, especially pod sa bata. No, it can affect the baby. It could lead to
In what
abortion,
way?
or it could lead to abnormalities like, dili mo tubo ang extremities. No, or it can affect the eyes, the nerves. So daghan siya complications, especially to a pregnant woman. So sa baby, so kuyaw kung kaayo.
Okay. Has there ever been kanang pregnant women?
Yeah.
Pero na okay ra?
Well,
How do you treat that? Kay, di ba when you're pregnant, you're not supposed to take medication?
yeah, but in such cases, you can treat the mother, the mother to be. Kay buntis manggod, and you want to protect the baby. But yes, I have seen 1 or 2 cases ngayon ana, the mother was pregnant and had chickenpox. So the baby came out nga dili gyud siya abnormal, dili gyud siya normal.
Ka-dangerous din,
Yes.
Doc, no?
Especially kada bitawng buntis nga mga nakay na within the example, end of the month mga nak, and within the 5 days before mga nak, up to around 2 days gikan sa pagpanganak, kung dinha mo guwa ang chickenpox sa mama, kuyaw nga si baby matakdan kay wala pa may antibody si mother. So the mother will not have time to form antibodies to protect the baby. So sa baby pwede pod na siya nga matakdan.
And lisod kaayo i-treat
Yes.
pag ang baby nga gamay pa kaayo.
Yeah, so we do have
lisod
protocols for that. We give medications to the baby. Yeah. Even if wala pa sila gibati, we can give medications actually.
Preventive mo rin
Yeah.
Doc. Oo. Sige, Doc. Okay, you mentioned vaccine. That's one way of preventing it. Other ways, unsa pa man, Doc?
Well, wear mask. Well, it's good that we're wearing mask, no? Kaya secretions man good yapon siya. Yeah, but otherwise, there's really no exact way to say prevent it totally. Okay, we are social beings, so we still go out even with the pandemic. But muna, the wearing of mask would help, frequent hand washing, no, this would help, and then muna, vaccinate.
Curious lang ko, Doc, ba, with kids, because you're a pediatrician, right? Ever since the pandemic started, nag-wear naman gyud mask, we're very conscious about washing our hands, putting alcohol almost all the time.
Yes.
Has there ever been murag effect sa number of cases of whatever kind of diseases or illnesses sa imuhang patients?
Yeah, during the initial part sa pandemic, no, when people really hiding, we are really seeing less cases of mga infections. No, although karon man gud medyo ni open up na, so we are seeing them malik na. Yes, mga viral infections daghan na kaayo, dengue, no. So naana pud ta. Okay, all the more nga they're staying in the house, magduwa sa garden. So we're seeing the comeback of these usual infections sa bata. with over 2 years na nga pandemic. But with the initial part, medyo hilom. Puro COVID.
Bitaw. Sige, Doc. Before we end our interview, any parting words to our viewers?
Yes.
Please.
So, first, I'd like to thank you, for this session, for this wonderful interactive session. And my parting words to our audience would simply be that, remember, chickenpox is a very contagious disease. Dali kay siya makatakod. Mas dali pa sa COVID makatakod. But the good thing is we can be protected by being vaccinated.
Thank you very much, Doc, for
Thank you.
imparting your expertise. And we hope to have you again in the show. Thank you
Sure.
very much.
I'm just a call away.
Thank you, Doc.
Sige, thank you.
And that has been for our second episode for Maayong Adlaw Docs Season 3. Thank you very much for joining us today, and I hope that you learned something from this episode. Please do share this episode to your friends and family so that they may also learn, okay, from our discussions today. Now, from their promise of Maayo, which in Cebuano means be well, discover a new healthcare experience in Cebu at the hospital at Maayo. I'm Priya Padilla Roleda from CDN Digital. And please, if you want to know more about the hospital at Maayo, please log in to their Facebook page or check them out at their website, which is www.themaayohospital.com, or better yet, call these numbers below. Till next time.